So what can the patients do at home, or really the general population do at home, to prevent implants from getting infected or get peri-implantitis, which is basically a small infection around the implant? What can we do? How do we prevent it? Because I know many of the situations are because there's plaque and there's accumulated plaque around the implant area.
So you've touched on the major points, and that is prevention. Just like we prevent issues around teeth, the same approach is being taken towards preventing issues around implants. And like you said, maintaining plaque control. So we definitely want to address periodontal disease if there's existing periodontal disease in the mouth, because those same bacteria don't discriminate whether it's the tissue around implants or the tissue around teeth. Of course, teeth have more of a potential to protect themselves against these bacteria because of the anatomy that exists, but implants don't have that advantage. So in fact, you want to take better care of the tissue around the implants. So we want to address the existing teeth, treat the periodontal disease, treat the patient's underlying diseases. If there's any systemic conditions, such as diabetes, as we know is spreading around in our country at greater rates, we want to have that under better control. And at home, patients can do additional things beyond brushing, such as flossing, as we always like the patients to do, but also using things such as the water pick, sometimes even increasing the frequency at which they brush and at which they come into the office. You know, part of prevention is also intervention. Having opportunities for the dentist to examine and see what's going on with those implants allows us to take action sooner rather than later. So, like so many other things, it's detection, prevention, and cooperation between the patient, the medical doctor, and the dentist.
Okay, very interesting. All right. You know, sometimes I think in my practice, well, is there a genetic component to it? Or, you know, as some people just develop more plaque, some people just have stronger teeth. Do you think that some people are just better candidates for implant?
Well, we know a lot about the genetic component for periodontal disease and specific genes related to patients and their susceptibility. There hasn't been that much development in relation to susceptibility for peri-implantitis, but when you look at the susceptibility in relation to periodontal disease, we're looking at the body's immune system and ability to fight off types of bacteria.
Okay.
So that type of bacteria, whether it be around the implant or whether it be around the tooth, is still the same type of bacteria. And any genetic components that create issues for a patient to fight it off in periodontal disease are going to be the same when it comes to implant diseases, so to speak.
Okay. So then how does, say, a type 1 diabetic deal with their implants? Because if they get a little infection in there, that's going to exacerbate because they don't have the strength to fight it off.
So again, we're going to try to work together. It's sort of three bodies: the patient, the medical doctor, and the dentist who's treating the patient. The dentist, obviously, we want to inform the patients of the component of their systemic health on their dental health. The medical doctor to help us control the patient's diabetic status, whether that require a change in medications, whether that require closer frequency of checking on the patient. There's specific tests that they do that the patient can't do on a daily basis. And then the patient themselves, are they checking every day? Are they controlling their diet? You know, we can help them to sort of follow their diet. Sometimes we don't know what we eat because we're eating without being conscious of it, but sometimes just keeping track of your diet, watching what you're eating, we can point that out and say, okay, you know what, the frequency in which you're eating is increasing the amount of plaque that you have, and maybe the things you're eating are affecting your diabetic status. So again, working together, everyone together, we can help to change some things and augment some things.
Okay, perfect. Great. Thank you so much, Dr. Frydman.